nutrition, and she will provide the opening remarks. Please go ahead, Vanessa.
Thank you, Leo. Hello, everyone. Hola, buenos dias, bon dia. Welcome to the Salt Awareness Week 2025 webinar to discuss the advances in salt reduction in the Americas. The Pan American Health Organization is pleased to organize this activity and to join the international community and our member states to further policy actions to reduce salt consumption and protect the health of our population. The largest number of diet-related diseases, an estimate of 1.9 million per year, is associated with excessive intake of sodium, a well-established cause of raised blood pressure and increased risk of cardiovascular disease. It is estimated that the average global intake of 10.9 grams of salt is more than double the WHO guidance, which is less than 5 grams per day. And that's broadly equivalent to a teaspoon. In the Americas, salt intake is about 9 grams of salt per day as of data from 2019. And our region is not on track to achieve the global target of reducing sodium intake by 30% in 2025. Reducing sodium intake is one of the most cost-effective ways to improve health and to reduce the burden of non-communicable diseases. The Pan American Health Organization supports its member states in reducing salt intake by implementing the WHO Shake technical package. And we are delighted to announce that an update of Shake will be launched shortly by the WHO, providing a strategic framework aimed at reducing sodium intake from all sources, including prepackaged food, meals consumed outside of the home, and discretionary salt use. This new version of the Shake package outlines the necessary steps and considerations for preparing, developing, implementing, monitoring, and evaluating effective policies and interventions. The region of the Americas has made advances in implementing the best buys for sodium reduction. For example, as some of you are aware, 12 countries have already adopted the front-of-package nutrition labeling of processed and ultra-processed foods which contain excessive amounts of sodium. And 9 countries, including Argentina, Brazil, Chile, Colombia, Ecuador, Mexico, Peru, Uruguay, and Venezuela, have already started their implementation. 3 countries are implementing maximum sodium levels for different categories of processed and ultra-processed foods. So we are making consistent progress, but it's just not enough at the moment to meet the targets. PAHO and the WHO provide support to its member states by developing different tools, including the updated PAHO reduction sodium target, which was launched in October 2021 and was developed in collaboration with the WHO Collaborating Center for Nutrition Policy for Chronic Diseases Prevention at the University of Toronto. This year's theme for the Salt Awareness Week highlights five ways to 5 grams with actions that persons can actually take, and they are feasible to reduce sodium intake. At PAHO, we will emphasize on 5 actions that country can take to reduce sodium content and consumption, including interventions to reformulate food products to contain less sodium by setting maximum target levels for the amount of sodium in foods and meals in a mandatory fashion, implementing standards for front-of-package labeling and marketing restrictions, creating supporting environments in public institutions to provide lower sodium options, applying behavioral changes in communication strategies through social marketing to reduce salt consumption, and measuring sodium population intake, sodium dietary sources, and sodium food content. These interventions are cost-effective and feasible in low and middle-income countries. So today we're going to hear from WHO on the updates of the shake technical package and country experiences, which are very important to us in implementing the WHO best buys for sodium reduction, as well as recommendations for the implementation of sodium reduction targets from a civil society organization and how to protect these policies from industry interference. We thank you all for your participation, and we hope this webinar continues to motivate and support countries to implement cost-effective sodium reduction policies using the tools developed by PAHO and the WHO. Thank you very much.
Thank you very much, Vanessa. And we have already 350 participants
Wonderful.
connected, and not only from Latin America and the Caribbean, but also from other parts of the world. We have a full
Fantastic.
program.
Thank
We will
you.
speak about and the new tool of WHO, the Shake 2.0, and we will listen as well the experience from countries in implementing monitoring of sodium content in foods, as well as the barriers and the successes in implementing the updated PAHO sodium reduction targets. We will hear about a new manual to be launched soon about social marketing campaigns for sodium reduction. And we will hear as well recommendations to progress the implementation of the updated sodium reduction targets and how to deal with conflicts of interest. Just to remind ourselves that there's a globe on the bottom of the screen where you can request the simultaneous translation. I will continue now. En Spanish, bienvenidos a todos. Para
Welcome,
recordar
everybody.
que
Just
tenemos
to remind
traducción
you, we
simultánea,
have
hay un
simultaneous
globo
translation. There's a
debajo en
globe
la
icon
pantalla donde ustedes pueden escuchar
below the screen.
el evento
You are going to
en
be able to
español
access
o en
the
inglés.
event
Entonces voy a seguir
with
con la
the
primera
Spanish or English
presentación
translation.
que está a cargo mío y
So I'm going to
Luis va
start
a
with
ayudar
the first
con pasar
presentation, and I'm
las
sure that Luis is
láminas.
going to help me
Entonces,
passing the slides.
adelante Luis con la siguiente
Luis, you can go
lámina, por
ahead
favor.
with the next slide.
Ok, entonces, ¿por qué nos
Well,
preocupamos
why
de la sal?
are we concerned
En
about
realidad,
salt?
80%
Actually,
de los casos de las
80% of
enfermedades no transmisibles,
cases of non-transmittable
digamos que
diseases,
las
ENTs,
enfermedades no
we
transmisibles
could say
causan el
that
80%
these
de las
caused
muertes en la
80% of
población
deaths in
en casi todos los
population.
países y
Basically, this happens in
también en
every
nuestra
countries,
región.
particularly in our
Tenemos un
regions.
20 a
And we have
35%
20 to
de adultos
35%
con
of
hipertensión en
adults
la
with
región.
hypertension
Y
in the
una de
region.
las primeras
And one of
causas
the
de la
first
hipertensión
causes
es el alto consumo
for
de sal.
hypertension is
Vemos
a
que la
high
OMS
consumption of salt.
recomienda
And we know
consumir
that
menos de
the
5 gramos de
WHO
sal por
recommends
día,
to
pero
have
el consumo
less than
actual
5
está
grams
entre
of
8 y
salt per
medio
day,
y
but the current
15
consumption is between 8.5
gramos
to
por
15
día,
grams per
o
day.
sea, 2, 3 veces
That
más de
means
lo
this is
que
2 or 3 times
es el
more
límite que propone
the
la
limit
OMS. Vamos
introduced
con la
by
siguiente.
WHO.
Hay mucha evidencia
So
que
there's lots of
disminuir
evidence
la ingesta
available.
de
We need
sodio
to
reduce de
decrease
forma
sodium
significativa la
consumption because
tensión
this reduces in a
arterial,
meaningful
tanto
way
en adultos
the
como
systolic
en niños
blood
y en
pressure
todos los grupos étnicos.
in adults and
También
children
hay evidencia
in
que
all
rebajar la ingesta
the
a menos de
ethnias.
2 gramos
Also, there's evidence that if you reduce
resulta todavía
consumption in
más
less than 2 grams
beneficioso
per day,
para la
this
tensión arterial
results
que
even more
reducirla sin
beneficial
bajar de
for
los
blood
2
pressure
gramos. Por
compared
eso
to
el
reducing
límite
it
de 2 gramos
without
de sodio o
reducing
5
more than 2
gramos de
grams per
sal
day.
al día. Y
So
sabemos
we know
que un
that
mayor consumo de sodio se asocia
the
con un
highest
riesgo más
consumption of
alto para
sodium is
accidentes
associated with the highest risks
cerebrovasculares
of
nuevos y
cerebrovascular
accidentes cerebrovasculares
incidents
mortales y
or
cardiopatías
deadly
coronarias
ACVs
mortales.
or
La
coronary
siguiente.
cardiopathies. This is why WHO recommends to reduce sodium consumption in order to reduce blood pressure and the risk of cardiovascular diseases. And even so, we recommend sodium consumption below 2 grams. For children, this recommendation should be adjusted as per the energy requirements of this child. It's important to mention that there's no minimum recommendation of salt, but we have a maximum limit because the salt that the human being requires is something that we could get naturally from our food. So there's lots of health benefits, economic benefits from sodium consumption reduction. A reduction of 30% in sodium consumption could save 40 million lives worldwide in a period of 25 years. The programs to reduce sodium consumption in low and medium income countries could generate an ROI of 13 to 18 per each dollar invested. So this is a ratio that is high, and this is one of the highest costs and benefits. We see that the salt consumption in the American region varies from 7.7 grams per day in Barbados to 8 point something in Colombia. So in this case, all countries are over the 5-gram limits of salt per day from WHO. Furthermore, we notice that the ratio of salt that we eat derived from processed and ultra-processed food is increasing. To the left, in a study that was held, we analyzed the energetic contribution from ultra-processed food, and we can see that this consumption is growing in this region, and many of these products are high in salt. This salt is not something that we can see because you're not adding the salt when you cook. This is already within the food that we eat. The analysis has shown that 63% of analyzed products in the 7 analyzed countries showed an excess of sodium. Gravies, sauce, cookies, industrial bread contributes 2/3 of sodium in the products that were sold in 2014. We performed a mapping a couple of years ago, and we were able to see the implementations of these guidelines and interventions. And this was highly cost effective because this is what is called the best buys. And we were able to see how was the implementation of these policies in this region. We can also see that the best buy implementations, these would be the best measures that were taken to reformulate the manufacturing of these products in order to reduce sodium. This included labeling, this included strategies on education and communication strategies in order to keep standards on consumption and maximum content. on food.
las escuelas o
This is something that
los hospitales.
could
Entonces,
be a
esta
recommendation for
herramienta
hospitals
está
or schools.
disponible en
So this tool
nuestra
is
base de
actually
datos que se
available in
llama
our
Enlace, que es el
database.
portal de datos de la
This is called
OPS en
Enlace. This
cuanto
is
al
basically
avance de
a
políticas
data portal.
en
This provides information on the
enfermedades no
progress
transmisibles
of
y factores de riesgo.
policies
La
on
siguiente.
non-transmittable diseases and what are the risk factors.
Vemos también acá el número de
Furthermore, we
países
can see
que
here the number of
que
countries
han implementado y
that
adoptado políticas para
have
reducir
introduced
el
policies
contenido de sodio
to
en los
reduce
diferentes
the sodium content
países.
in diverse
Y
countries.
tenemos por cada país también
We can
una
see
ficha donde
that each
tenemos
country
el
has
avance.
its own data
En
sheet
general, sí
with
hay
the progress.
un número creciente que está
Overall, there is an
implementando
increasing number of
alguna política de
countries
sal, pero
implementing
todavía
salt
falta avanzar en
policies,
las
but
políticas
we
más
still need to go a long way
eficientes.
in the
Vemos
most
en esta
efficient
lámina, la siguiente,
policies.
Liz. La
We also
siguiente.
have this next slide,
La siguiente. Que algunos
which
países, hay muchos países que tienen
actually some countries
algún acuerdo voluntario para
have
reducir el consumo de sodio
a
en la sal.
volunteer
A
agreement to
veces estos
reduce
son
sodium consumption in
acuerdos
salt.
logrados con la
Sometimes these agreements
industria o son,
take place with the industry,
digamos,
or
metas que
we
la
could say
misma
that these
industria
are goals
propone,
that
pero
the
en general hemos
industry
visto que esas metas no son
provides as a
muy
proposal. But
ambiciosas
we
y
could
por
say
eso
that
no
these
hemos
goals are not
podido avanzar
ambitious.
mucho en la reducción
So we were not able to make a lot of
del contenido de
progress
sal
in
en los
reducing
alimentos.
sodium content in
Actualmente tenemos tres
or salt
países
content,
donde hay
sorry,
una
in food. And actually,
política
we have
obligatoria
3 countries where we
con
have
niveles
mandatory
máximos de
policies
contenido
where
de sodio en
we
los
have the
alimentos
maximum level of
procesados.
sodium
Y
content
esos
in
países son
processed foods.
Argentina,
And these
Paraguay
countries
y
are
Colombia. La
Argentina,
siguiente.
Paraguay, and Colombia.
Vemos en Argentina
In
que
Argentina, for example,
tienen una ley que se aplica a
we have a
25
law that
subcategorías
applies to 25
para los productos
subcategories
envasados.
for
Fue el primer país
packed
en
products.
tener
This was the first
políticas
country
de
that
reformulación.
actually had
Y
reformulation
Paraguay
of their
siguió, pero solo tiene
recipes.
una
Paraguay
subcategoría que es
followed
el pan de
Argentina, but
consumo
they only have
masivo, es el
one
pan
subcategory, which is
artesanal.
the
Y
handcraft
Colombia
bread
es
or
el país más
artisanal bread.
reciente y
Actually,
tiene
Colombia is one of the recent
criterios muy en
additions
línea
here,
con lo que
and their
recomienda la
criteria is aligned
OPS
with
y
what
lo aplican a
the
59
WHO recommends,
subcategorías.
and it's
La
actually applied
siguiente.
to 59 subcategories.
La ventaja de las políticas
The
obligatorias es
advantage
que
of
en
the
general son
mandatory
más estrictas
policies
en los
is that
límites que
they are more
proponen.
strict
También
with
es una
their own
ventaja para
limits.
las
This is
empresas
also an
porque
advantage for the
actúan
companies
en
because
igualdad de condiciones
they
y
act
eso pues les
in
facilita,
in an
digamos,
equal field of conditions, you would
ir
say.
reduciendo paulatinamente el contenido de sodio en los alimentos sin tener que ver con
And in this way,
una
we can
competencia
reduce sodium
desleal
content
y el
without
consumidor
having
automáticamente va a adaptar
unfair
su
competition.
paladar
So the consumer
a
could
un
adapt their
sabor menos
palates
salado de los
to a flavor that
alimentos.
could be less salty
En un
for
modelaje
foods.
de políticas hecho en sodio, eh, vemos
So
que
when
una
it comes to
reformulación
modeling
en base de
policies to reduce
metas
sodium
nacionales puede
consumption
tener
in Brazil, we could see that
una reducción de consumo de 0,249
this could have a reduction of
gramos al día,
0.249 grams per day,
relativamente pequeño, y bueno, se pueden prevenir
which
5.000
is
muertes por
small, but we
enfermedades
could prevent
cardiovasculares.
5,000 deaths
Y
caused
si
by
las metas
cardiovascular
voluntarias
diseases.
son implementadas obligatoriamente, la reducción es un poquito
But if these
mayor,
goals are
pero si
implemented
son metas más
mandatorily, this
estrictas,
figure could be even
implementadas
higher.
obligatoriamente, estamos hablando de una
We
reducción
could be talking about
diaria de casi
a
un
daily
gramo
reduction of
al
almost
día.
a gram per day.
sí tiene un impacto mucho más
And actually, this
grande con
has
15.000 muertos
a larger impact
prevenidos. La
with
siguiente.
15,000 deaths that could be prevented.
La OMS, la OPS, contaba con la
The
anterior,
PAHO
las
and
con metas
WHO
regionales
actually had regional
desde
goals
2015 y
for
al
2015.
monitorear en los diferentes
And the
países el
idea was to
contenido de sodio en
monitor
los alimentos. Se veía que
the
esta
content
norma
of
era muy
sodium in
blanda y
different
que de
countries.
hecho
And we noticed that this act was
muchos
actually
productos ya
quite soft,
alcanzaban
or this standard was
estas
soft,
metas.
because
La siguiente.
many products
Por
were
eso,
reaching this
basado
goal.
en
That's
datos
why,
que teníamos de
based on
14
data that we
países,
had
gracias
from
al
14
sistema de
countries, and
monitoreo
thanks
que
to the
escuchemos más
monitoring
tarde,
system
hemos
that
logrado
we're
una
gonna hear
actualización
about later,
de
we
las
have
metas
made an
ubicadas en
update on regional goals
2021.
that were published in 2021.
Siguiente. Las metas acompañan de
The
un
goals
documento
actually come
de,
along with
que es
this
una herramienta
document, which is a
que sirve
tool
para abogacía,
that helps us
para,
for
y
advocacy.
incluye preguntas
And this
frecuentes también
includes
para poder
frequent questions
responder
in order
al
to
público o al sector privado, a los
respond to
políticos,
the
el porqué
public, the private
de
sector,
estas
or politicians
metas y
on
por qué
why
son
we are setting
efectivas y
these
por qué
goals,
deben
why is this
implementarse de
effective, and
manera
why we should implement them
obligatoria. La
mandatorily.
siguiente. Y las metas
These
se dividen
goals
sobre
are
16
divided
categorías con
on
sus
16
diferentes
categories with
subcategorías. Vamos a la siguiente.
the diverse subcategories as
Y
well.
vemos aquí un
And we
ejemplo
can
de la
see
categoría
that there's an
de
example
pan con
by
sus
bread
diferentes subcategorías.
category, and it
Cada
has subcategories.
subcategoría tiene una
Each
meta
subcategory
máxima,
has a
un límite
maximum
máximo
goal, a maximum limit
para el 2025 y un
for
límite más
2025,
bajo, o sea, más
and an
estricto
even
para el
lower
2025.
limit, or more
Además,
strict
en
limit
línea con
for
el perfil de
2025. This is
nutrientes de
aligned
la
with the profile of
OPS y
nutrients
las
by
directrices de
PAHO and the
la OMS
guidelines
en cuanto
from
al consumo de sal.
WHO when it comes
Vemos
to
también
salt
que
consumption. We can
existen metas
say
para el
also
nivel
that
de sodio
there's
por
goals for
kilocaloría, porque
sodium content
la
per
relevante
kilocalories,
directriz de la
because
OMS
actually the guidelines
dice
from the
que lo
WHO
máximo sería un
state that
miligramo
the
de sodio
maximum
por
would be 1 milligram of
kilocaloría
sodium per
consumido, y
kilocalorie
eso corresponde
consumed.
a
And this would
2
be
gramos de sodio o 5
2
gramos de
grams
sal
or
para una
5 grams of
dieta
salt
de 2.000
for a
kilocalorías.
diet of
Em,
2000
es
kilocalories.
posible, bueno, en muchos casos se reformula el pan porque se consume en
And it is
cantidades
possible
grandes.
that we could reformulate the bread
No es la cafetería
recipe
que es
because we eat it in
que
a
tiene
large
el mayor
amount. We
contenido
could
de
say that
sodio,
this is
pero
not
por
the
el
food category
consumo
that has the highest
relativamente
sodium content, but
importante
due to
en
its high
minutos
consumption,
se
regularly
decide reformular el pan,
we
pero hay
would need
otros productos
to
como los
reconsider
embutidos,
its
digamos,
formulas.
que
But for
sí se
example, if we
consume
think
menos, pero
about
el contenido de sal es mucho más
meat,
grande.
we
Entonces,
could
estos
say that
productos,
the salt
aún
content is even
después de
higher.
una reformulación,
But
siguen
in
siendo
these products,
altos
even after
en
there's
sodio, y se
any type of
requieren
reformulation, we would still
políticas
have a high sodium content,
complementarias
and we would need
como restricciones de publicidad o de
supplementary
etiquetada frontal en
policies, like,
alimentos
for
para
example, marketing or
desincentivar su
labeling
consumo
in
y
order
para
to
lograr una
discourage
mayor reformulación.
consumption.
Finalmente, siguiente,
Finally,
para alcanzar estas
in
metas
order
es
to
importante
reach
tener
these
un
goals, I
liderazgo
think
a
it's
nivel nacional,
important
tener
to
una
have
iniciativa nacional para
leadership
reducir la exposición de la población a estos
to
alimentos con
reduce
contenido excesivo de sal,
the content of
adoptar
this
las metas
salt. We would need
y
to
promover e implementar
adopt these goals,
otras
and we
políticas,
would
un
need to
paquete de
promote,
políticas
implement,
para
and
reducir el
apply
consumo
a
y
package of
promover
policies to
la
reduce
acción
consumption and promote
multisectorial para la prevención de las
multi-sector action
enfermedades
to
no
prevent the
transmisibles
NCDs, the non-communicable
y
diseases,
manejar
And we would need to manage the possible conflicts of interest.
Y muchas gracias. Acá me quedo yo con esta presentación.
Thank you, and that will be all for my presentation.
Y voy a pasar la palabra.
And now I will give the go-ahead to
y ella es oficial técnica de la OMS.
She is a technical officer from the WHO,
and she's going to talk about the shake. Shake is very well known in our region on the cost-effective packages. WHO has been working on this, and it's launching a new version of shake based on all the lessons learned of shake implementation, the shake that we all know.
Kaya, I give you the floor for your presentation, and thank you very much for being with us.
Thank you very much, Leo, and it's really a pleasure to be here today and to be able to give you a high-level overview of the soon-to-be-released updated version of the SHAKE program guide. Next slide, please. So the SHAKE program guide promotes comprehensive sodium reduction programs with multiple interventions across a range of settings. For example, in food production and processing, where it is necessary to reduce the content of sodium in foods and also apply labeling on the manufactured food. In food retail and shops, it is necessary to label, to nudge, and to price the product to make healthier food choices more available, and also to enable healthier consumer choices. In media and communication, it's important to provide consistent messaging about healthy sodium intake and to restrict the marketing of high sodium food. In homes, it is necessary to change consumer practices to reduce the purchase of high sodium food and to reduce the use of discretionary salt in cooking and while eating. And in public settings such as schools and hospitals, as well as in restaurants and food outlets, to reduce the sodium content in the out-of-home meals and to reduce the use of discretionary salt in these settings. Such a comprehensive approach is more effective than relying on a single approach to reduce sodium intake. Next slide, please. So the SHAKE package is built around a set of interventions. And these interventions have also been mentioned by Leo in his presentation because they have an impact on sodium intake. A set of policies addressing the food systems regarding food reformulation, food and nutrition labeling, food procurement and service, food marketing restrictions, and taxation of unhealthy food. These policies, they most often rely on nutrition criteria to identify the food that is high in sodium and are therefore facilitated by sodium content declaration on pre-packaged food. In addition, interventions that change consumer behavior and practices include communication and mass media campaigns for healthy diets, and in appropriate settings, the use of lower sodium salt substitutes to replace regular salt. Can you click again, please? Now, several of these interventions are included in the WHO Best Buys for the prevention and control of NCDs. And there are some footnotes here. For example, for food and nutrition labeling, the impact pathway for sodium reduction is via front-of-pack labeling. In food marketing restrictions, which became a Best Buy in the 2023 update of the Best Buys, sodium is currently not included in the impact pathway, but it is recommended in the WHO guideline for comprehensive nutrient profile model that includes multiple nutrients of concerns. And for taxation, the Best Buy is so far only for sugar-sweetened beverage taxes that are estimated as a good buy for NCD prevention. However, as also indicated on these slides, most of these interventions also have specific WHO guidance. Guidelines exist for marketing restrictions, for fiscal policies, and for lower sodium salt substitutes. Guidelines on food and nutrition labeling and for school food and nutrition policies are being developed and will also soon be released by WHO. Reformulation to reduce sodium content in food builds on the WHO global sodium benchmarks and food procurement and surveys on the related WHO action framework. Next slide, please. So I heard that the shake is well known in the PAHO region, and that's fantastic. So what's then new in the updated shake? So compared to the first shake of 2016 that you all know very well, there are 2 additional sodium reduction interventions that have been included in this version. The one is taxation of unhealthy food, and the second is lower sodium salt substitutes. So I will talk a little bit about these 2. Next slide, please. So the 2024 WHO guideline on fiscal policies to promote healthy diets includes a conditional recommendation for taxation of food that do not contribute to a healthy diet. This recommendation is conditional due to the nature of the evidence, as you can learn more about in this guideline from the recording of the launch webinar, which is linked on this slide. So as part of the SHAKE guide for program design, it is suggested for countries to use data on sources of sodium in the diet to prioritize the food categories that can be subject to tax in the country. Countries can also consider to use tiered taxes based on thresholds for sodium content, which is the approach taken by some countries, like Colombia in the PAHO region. This, of course, requires that nutrient content is declared on a mandatory basis on all prepackaged food. Tiered taxes allow higher taxes the higher the content of sodium or of other critical nutrients, and therefore also encourages reformulation of those food products. As highlighted in that WHO guideline, taxes on food may be most effective if they are coupled with subsidies on healthy food, to shift consumer preferences towards healthier diets. And the tax revenues generated can be used for such subsidies or for other health purposes to increase the acceptability of the taxes. Next slide, please. In January this year, WHO published guidelines on the use of lower sodium salt substitutes to replace regular table salt in appropriate settings. The recommendation is quite long, but it can be divided into 3 parts. If you click one more time, please. Can you click one more time? Yes, thank you. So the first part of the recommendation set the context of the recommendation, and that is linked to the WHO guideline that Leo spoke about earlier, that sets the maximum recommended intake of sodium of 2 grams per day. And we're using less salt is an important part of an overall sodium reduction strategy, less regular table salt. The second part of this recommendation is the core of this recommendation. It's a conditional recommendation where WHO suggests replacing regular table salt with lower sodium salt substitutes. This recommendation was assessed as conditional because the overall certainty of the evidence was low, and also, importantly, there was uncertainty about the balance between the benefits and the potential harms, especially in settings where a considerable proportion of the population may have undiagnosed conditions for which it would not be advisable to increase the potassium intake. For example, populations in low resource settings may not be aware of having these conditions. Now, the second part of the recommendation also specifies the scope of the recommendation. First, the mode of the use. The recommendation applies to discretionary use of lower sodium salt substitutes in the form of table salt, meaning that salt that an individual adds to the food during cooking or when eating. It does not apply to non-discretionary salt, meaning salt that is already present in manufactured food or food served at restaurants outside of the home. Similarly, the condiments like soya sauce and fish sauce are also out of the scope. This is because the evidence were limited on such uses of lower sodium salt substitutes. Secondly, this part of the recommendation also specifies the type of the lower sodium salt substitutes. The recommendation in this guideline applies to lower sodium salt substitutes with potassium, since the majority of the trials considered in the guidelines looked at the substitutes that contain potassium. The third part of the recommendation defines the target group to whom it applies and to whom it does not apply. If you click again, you will get some link also to learn more about this guideline by watching the recording from the launch webinar. Or you can also attend an expert hour session that is coming up this Friday. Click again, please. Next slide. So in a more plain language, this conditional recommendation can be interpreted as implement the recommendation to use lower sodium salt substitutes if safety considerations can be accounted for and monitored carefully, especially because of potential risks of hyperkalemia. So as part of the SHAKE guide for program design, it is suggested that countries that are considering this intervention, first of all, assess the appropriateness of the use of this product in their population, including population at risk of kidney disease and hyperkalemia, that they ensure the health system is capable of identifying kidney disease in the population, and consider lower sodium salt substitutes as one potential intervention as part of a comprehensive sodium reduction program. For countries that decide to proceed with this intervention, they may consider increasing population awareness of this product, setting the standards for the substitutes, including for at what level they should be iodized, and how they should be used, for example, in public food procurement and service programs. Also, as these products become increasingly available in the food supply, it is important to monitor their use and if they are included in manufactured food products. Next slide, please. So back to the SHAKE program guide, where these interventions and policies are at the centerpiece. And the SHAKE package guides countries in preparing for, developing, implementing, and monitoring these interventions as part of a comprehensive sodium reduction program. This logic model that you see on this slide shows how SHAKE outlines activities that leads to output related to governance, food supply, food environment, and consumers, which in turn leads to healthier diet and reduced sodium intake, which in turn lead to health and economic impact. SHAKE recommends comprehensive sodium reduction programs and using mandatory approaches. But reality in countries is that it's unlikely that all these interventions can be implemented immediately. Next slide, please. Therefore, prioritizing where to start should be based on what the main dietary sources of sodium is in the country. If the main source is manufactured food, then reduction of sodium through reformulation and interventions to reduce consumer demand through labeling, marketing restrictions, taxation, and media campaigns are good places to start. If out-of-home meals are a significant source of dietary sodium, then reducing sodium in food served or sold and enable healthier choices in these settings is important. And if discretionary salt is the main source of sodium, then the interventions to reduce the use of salt in and out of home are important. And if the context is assessed as appropriate, through the use of lower sodium salt substitutes. Next slide, please. I will do a very high-level overview of the three main parts of SHAKE. The first part concerns the preparation for a comprehensive sodium reduction program, where it is suggested that countries commit to bold action to reduce sodium intake by setting intake or program goals that are SMART, meaning specific, measurable, achievable, relevant, and time-bound. That they establish a government-led working group, that they understand and engage multiple sectors and stakeholders while managing conflict of interest, and that they invest in data for impact and monitoring, which is important. And there are various pieces of data that are necessary to collect or that are very useful to have for a comprehensive program. This includes the measurement of population sodium intake. The gold standard is 24 hours urinary collection. And in addition to sodium intake, it is important to measure potassium and iodine intakes. Information about the sources of sodium in the diet is a critical piece of information to help prioritize action and build on the information about levels of sodium in the food supply. The information about consumer knowledge, attitude and practices, and food environment factors such as the use of labels, extent of marketing or food prices help design the interventions that are effective in the context. And information about the current policy environment in support of sodium reduction help to identify gaps. So the SHAKE program guide includes specific information and annexes that describes what each of these data collection activities are, why they matter, where you can start, the approaches to take, how to analyze and report, and link to selected technical resources. Next slide, please. The second part of the SHAKE program guide focuses on developing and implementing a comprehensive sodium reduction program. There it is discussed how to prioritize mandatory intervention to be part of a comprehensive sodium reduction program. This is because implementing a comprehensive government-led sodium reduction program with a mandatory approach to food reformulation, food and nutrition labeling, food procurement and service, marketing restriction, and taxation of unhealthy food is expected to be the most effective approach and, like Leo also said, creates a level playing field across the board. The design of these policies build on nutrition criteria to identify high sodium food to, for example, bear a front-of-pack warning label. And this, of course, in turn require the mandatory declaration of sodium content. So for each of these sodium reduction policies and interventions, SHAKE provides guidance on what it is, why they matter, the WHO guidance, the expected impact, the approach to take, and provides links to the selected technical resources. For effective implementation, countries also need to build capacity and support, set timelines, and allocate budget and plan for monitoring. And as the comprehensive sodium reduction program leads to reduced intake, it may be necessary to increase the amount of iodine added to salt, both regular table salt and lower sodium salt substitutes. Next slide, please. The third and last part of the SHAKE program guide emphasizes the importance of monitoring for enforcing compliance, as well as for evaluating the progress towards sodium reduction. And each of these subsections describe again what it is, why it matters, where to start, the approach, and they link also back to the data collection activities described earlier and the logic model showed on one of the earlier slides. Next slide, please. So just to conclude this presentation, taking a comprehensive approach to sodium reduction, it's not new, although the expanded SHAKE is being published very soon. WHO has been monitoring the implementation of all these interventions, or most of them, apart from the lower sodium salt substitutes, since 2021 in the sodium country scorecard. And as you can see on this slide, which shows the global state of these interventions, there is still a lot of work to be done. The dark green countries are implementing at least 2 mandatory sodium reduction interventions. And remember that we are recommending many more. They also have mandatory sodium content declaration and all the 4 sodium-related best buys. The light green countries implement at least 1 mandatory sodium reduction intervention and also mandatorily declare sodium content on prepackaged food. These data are also used in reports, and in 2023 we published the first global sodium report, And the second report is planned to be published later this year to track country progress towards them taking comprehensive action on sodium reduction. Thank you very much for giving me this opportunity to present this updated package of shake.
Thank you very much, Kaya. Very comprehensive presentation and very good also that you highlight that there is not one intervention better than another, but that we really need to implement the whole package of interventions if we want to have good results, and that we also need to know what our sources are of dietary sodium to fine-tune our strategy. And thank you for highlighting this new shake programmatic guidance, and we will definitely disseminate this among our region once WHO will launch it. So thank you very much, and we continue with the next presentation, which will be about monitoring the sodium content of foods. And one of the countries that have a lot of experience in that is Argentina. Entonces, voy a dar la palabra a Victoria
I'll pass the floor to Victoria Tiscornia. She's from the Inter-American Fund of the Heart of Argentina. And she's going to talk about the monitoring and experience on sodium content in processed food. 15 minutes, please.
Muy buenos días, gracias Leo. Bueno, para empezar, muchas gracias por la invitación.
Thank you very much for the invite.
Acá compartiendo la experiencia
I'm
argentina
really happy to be here to
sobre el
share
contenido de sodio en los productos
on the
envasados.
Argentina experience,
Desde FICA Argentina
packaged food in Argentina.
investigamos, incidimos y comunicamos para promover políticas
We communicate
públicas
and we
que
promote
atiendan el derecho a la salud
public
mediante
policies
la prevención de
through the
enfermedades
prevention
crónicas no
of
transmisibles.
non-transmissible
En cuanto primero me
diseases.
gustaría empezar contándoles un poco
First
del
of all,
contexto
let
político de
me tell you a
Argentina.
little bit of
Acá
the
resulta que dos
Argentinian
tendencias complementarias
background.
que buscan
There are
reducir
two
el consumo de sodio en la
complementary
población. Primero,
regulations in
la
Argentina.
primera
The
ley es
first
la Ley
one,
Nacional de
or the
Reducción
first
del
law,
Sodio, que
is
fue
the
sancionada en el
National Sodium
2013.
Reduction Law
Argentina fue pionera en tener una ley
26905. We were
de estas
pioneer
características en América Latina,
in
que
these kind
establece
of
límites
policies
máximos
in Latin
de
America.
sodio para tres
Maximum
grupos de
sodium
alimentos:
limits for three
carnes y
food
productos
groups:
cárnicos,
meat and meat
farináceos,
products,
sopas, caldos y
farinaceous
aderezos.
and soups,
También
bouillons
esta
and
ley incluye
dressings.
campañas
This
educativas
law
y estrategias
includes
para los
educational
restaurantes,
campaigns
como
and
menús bajos en
strategies
sodio
for
y
restaurants,
restricciones
such
en
as
el uso de
low
sal.
sodium menus and restrictions on salt
Siguiente.
shakers.
Otra de las
Next, please.
políticas relevantes que tenemos es la
Another
Ley de Promoción de la
policy
Alimentación
has to
Saludable,
do with
conocida
the
como la Ley
Healthy
de
Food
Etiquetado
Promotion
Vegetal,
Law.
que fue sancionada en el año
This was
2021
sanctioned
y su implementación
in
fue gradual,
2021,
comenzando en
and
el
its
año
gradual
2022.
implementation
Asimismo,
started in 2022.
esta ley no solamente incorpora
Likewise, this law is not
etiquetados
only
frontales de
adding
advertencias para
the
nutrientes críticos, incluido el
labeling
sodio,
for
sino que también
critical
regula la publicidad de
foods, but
alimentos
also it
destinados a niños y
regulates
adolescentes,
the
promueve un entorno escolar saludable,
intake
prohibiendo la
in
oferta y la venta de estos productos
teenagers,
en todas las
children,
escuelas,
and it
y también
avoids the selling these products
prohíbe su oferta
and
en
prohibits
programas de
the
asistencia alimentaria,
it's
hace
being
que esta
included
ley
in other programs,
sea
and that's why
una norma central para
this is
limitar
an
la
important
ingesta excesiva de
regulation
nutrientes
to
críticos en
avoid the
toda la
excessive
población.
intake
Y
in
algo
all
muy
the
importante es que usa
population.
el perfil de la Organización Panamericana de la Salud
And this
para
uses
determinar
the
el contenido
profile
excesivo de nutrientes críticos.
of PAHO in the
También vale
different,
la pena
in
aclarar que
critical,
a
of
fines del
critical
2024
sodium content.
sufrió modificaciones por parte del Poder Ejecutivo
There were also
a
changes
través de
from the
dos
executive
disposiciones
power
que
through
debilitaron el
two
espíritu de la ley y de su reglamentación, ya
regulations,
que uno de los cambios más
because one
significativos
of
que
the
tuvo
most significant
es
changes was
afectando el perfil de nutrientes de la
affecting
OPS
the
y solo considera ahora los nutrientes
PAHO
críticos
profiles.
agregados, excluyendo
And
solo los
now
nutrientes
there are
intrínsecos, lo que esto
intrinsic
se
nutrients
traduce
that
en que
were
los
added,
productos
and
van a
this
exhibir
translates
menos
in that
CO2
the
de los que
products
deberían
will
tener,
have
reduciendo
less
así la
sodium
eficacia de la información brindada
by
al consumidor.
reducing the
Siguiente, por favor.
by following the efficacy of all these guidelines.
En con respecto a
Now,
monitorear
regarding the
los
monitoring
alimentos en
sodium
Argentina,
content in
desde Argentina
Argentina,
empezamos a hacer
in
análisis
Argentina,
desde
we
la
started
sanción de
with
la
an
ley del
analysis
2013
from
hasta la
the
actualidad.
since
Y
2013 up to
el
now.
último análisis fue llevado a cabo
And
en el
the
año
last analysis we
2024
performed in
con el apoyo de la
2024
Organización Panamericana
and
de
being
la Salud.
supported by
Siguiente, por favor.
by PAHO. Next.
Los objetivos de este último
Our
monitoreo fueron
aims
analizar el
for the
contenido de
last
sodio
monitoring
de productos
activity
envasados
was
en
to analyze the
Argentina,
sodium content of
comparar nuestro
processed and
contenido
ultra-processed food products sold in
con el
Argentina,
año anterior,
compare
con
sodium
el
content
último monitoreo en el año
compared to the
2022,
previous year,
analizar el cumplimiento de la Ley Nacional de Reducción de
analyze the
Sodio
compliance
y
or assess
evaluar el
compliance with the
cumplimiento de las
National
metas
Sodium
regionales de
Reduction
esa
Law
Organización
and
Panamericana de la
evaluate
Salud.
compliance with the updated
Siguiente.
PAHO regional
La metodología
program.
utilizada fue igual a los estudios
The
anteriores, en donde se
methodology
agregó
was similar
información
to
adicional de
other
productos que estaban ultraprocesados en dos supermercados de
ultra-processed
cadena
and
líderes
processed
de la
products
ciudad de Buenos Aires,
in Buenos
mediante el uso de
Aires.
la
The
aplicación
data were
TIC de
collected
los
in
meses
April,
de
May
pronto
2024 from two
durante
major
el
supermarket
año
stores.
2024. La recolección se
This
realizó
collection
escaneando
was
la información
performed by
nutricional de todos
scanning
los productos procesados
information
y
from the
ultraprocesados
different products,
disponibles en la
ultra
góndola del
processed and
supermercado
processed
al momento del
products in
relevamiento,
supermarkets
fotografiando todos los lados
by taking
del envase.
pictures the different
Siguiente, por favor.
packaging.
Bueno, los resultados mostraron, bueno, la
Results
muestra final fueron
or the final sample
3.915
analyzed
productos
included a
que se
total
clasificaron en 19
of
grupos de alimentos y 66
3,915
categorías.
products
Las
classified
categorías de
in
alimentos
19
con
food
mayor
categories.
contenido de sodio resultaron ser
The five categories with
hamburguesas,
highest
carne y
median sodium
pescado, los
content, meat
aperitivos,
and fish,
los
condiments,
cocinados, los quesos
appetizers,
duros, los
lunch and
aderezos,
meat and
y lo que se
sausages,
observó fue una
hard
gran
cheese
mayoría de
and
contenido de sodio
dressings.
adentro
We
de una
also
misma
see a high
categoría.
content in the
Siguiente.
same category. Next.
Adicionalmente, se comparó el contenido de sodio por categoría de alimentos entre las dos últimas
Categories with
mediciones
reduction in median
2022 y
sodium content.
2024. Y se detectaron
Comparison
reducciones
2022 and
significativas
2024.
en 11 de las 66 categorías analizadas.
11 out
Entre
of
ellas se pueden mencionar los
16
panes,
of
las galletas,
categories.
los productos a base de soja, los platos
We had
precocidos,
all
las
these
bebidas,
meat and fish
las sopas
condiments, toast,
vegetales,
pre-cooked
los
meals,
condimentos,
bouillon
los
cubes
caldos
and
y alimentos
powders,
para lactantes,
soy-based
entre
products,
otros.
canned vegetables,
Siguiente.
foods and for infants,
Con
among
respecto al
others.
análisis de cumplimiento de la Ley Nacional de
Regarding
Reducción de
the
Sodio,
compliance
se
with the
evaluaron
National Sodium Reduction Law
866 productos
2024,
que eran los regulados por la ley y se observó una
866
tenía
products
un
were
cumplimiento del
analyzed,
94% de los
reflects high
productos
compliance with the national
cumpliendo los
regulation,
límites establecidos. Las
94%.
categorías con mayor
The categories
incumplimiento
with
fueron pan de
more
hamburguesa,
incompliance,
mayonesa, snacks, pan
meat,
lactal, hamburguesas y otros embutidos.
meat products and
Con
other
respecto a la comparación con las metas regionales de OMS,
according
siguiente, por
to
favor.
the PAHO and the
Se
goals,
observó
the
que
targets we had,
44% de los productos evaluados exceden las metas
24%,
establecidas en el año
44%
2022
exceeds
y más del
the
52%
2022
exceden
PAHO
las metas
targets and more than
2017. Y las
52% exceed
categorías con
or
mayor
surpasses
incumplimiento en
2025
ambas,
PAHO target.
con ambas, digamos, metas 2022 y
And the
2025
group foods with the
fueron
highest
pastas,
percentage of products
aperitivos,
exceeding the
salados,
2022 and
productos cárnicos,
2025
pescados,
targets,
procesados y
fresh and
carne.
dried plain pasta and noodles, savory snacks, processed meat and
Siguiente, por
poultry,
favor.
processed fish, and others.
Bueno, para terminar esta presentación, lo que vimos en
My
el
final remarks.
monitoreo
What
del
we've seen
contenido de
on the
sodio de los productos
monitoring and the
envasados a lo
content of
largo del
sodium
tiempo
in
es
packaged
que
products a long time
representa una
is that they
herramienta
represent a
clave
tool, a
para,
key
por un lado,
tool
evaluar el
for
grado de cumplimiento con la
assessing
normativa
the
vigente. En
compliance
segundo lugar,
with the
para identificar
regulation and
oportunidades de
to
mejora
identify
y
improvement
actualización en línea con los
areas and
estándares
update
nacionales e
areas aligned
internacionales
to
de
the
salud pública.
standards,
Y en tercer lugar,
international
para generar
standards,
evidencia que fortalezca el
and also
diseño
helped us
e
create
implementación de políticas
evidence
públicas
of
más
design and
efectivas.
implementation of
Un hallazgo muy relevante del
public
estudio
policies.
es la complementariedad entre estas dos leyes
Something
y
that we
vigentes que
have
tenemos en Argentina,
found is
orientadas a
this
reducir el contenido de sodio en alimentos
complement
procesados.
uh,
Cuando
item.
comparamos, sobre todo,
When we compared
el monitoreo que se realizó en el
the
año 2022
monitoring
con el del
that was performed in
2024,
2022 and
vimos reducciones
2024, we've
significativas
seen
en 11 de las 66 categorías
meaningful
analizadas.
reduction
Y
in
estos
all the
cambios
categories. And these
observados
changes,
podrían estar
observed
vinculados
changes,
a
could be
procesos de
linked
reformulación
to
derivados de la
reformulation
implementación de la
processes
Ley
on
de
the
Adopción de Alimentación
implementation
Saludable,
policies,
especialmente por la adopción del
especially
etiquetado frontal de Argentina de advertencia
on
54
this front of pack labeling, and this law was implemented in these two different areas. And these similar reformulation trends have been observed in other countries
una reducción significativa en los nutrientes
with
críticos
where
los
we have
productos
seen
alcanzados
critical
por la ley y además una reducción
trends
en
and a
las
reduction
compras de estos
of
productos.
the purchase of these products.
Con respecto a las recomendaciones
Now,
políticas
regarding
derivadas del
political
estudio,
or
podemos
policies
decir que si bien en
recommendations
Argentina
or
se han
policy
logrado
implications, we could say that
avances
national
regulatorios
sodium reduction
importantes
law,
para reducir
for
el aporte de
example,
sodio en la
and
población,
healthy
las
eating
normativas
promotion
vigentes
law,
aún presentan
and they helped
desafíos
us
graves
reduce the
para
consumption
ser
of
abordados.
sodium.
En relación con lo que es la Ley Nacional de Reducción de
Regarding
Sodio,
the National
estudio
Sodium Reduction
identifica
Law, our study
oportunidades
identified
concretas de
concrete
mejora y de
opportunities
actualización, tales
for
como que
update,
se puede ampliar
updates
el
and
alcance
improvement
de
to
la ley
extend the
incorporando
scope
a
of the
nuevos
law
grupos
by
de alimentos
incorporating
que
new
actualmente no
categories
están
that
regulados,
represent a
pero que
significant
representan
source of
cuotas
sodium
relevantes de
in the
sodio en la
Argentine
alimentación de la
diet,
población y que además han sido identificados
and that were
como grupos de
identified
alimentos con alto
as
contenido de sodio según
high
el último monitoreo.
sodium content,
También los resultados
according to the last
muestran una
monitoring.
gran variabilidad en
And
el
the
contenido de
second
sodio
one, there is a
intracategoría.
lot of
Esto da
varieties
cuenta de
of
las
sodium
posibilidades tecnológicas
in just
de
one
establecer
category
metas más exigentes en
that
línea con
helped
los
us to
estándares
establish
regionales e
other targets
internacionales
in a
como los de
regional
la
and
Organización
international
Mundial de la
manner,
Salud y
such
la
as
Organización Panamericana de la Salud.
PAHO
Y
and
en cuanto a lo que es la ley
WHO.
de
And regarding
etiquetado,
the
es fundamental
labeling law,
defender
it's
la ley
important
de
to
posibles
defend the
retrocesos
law
y asegurar su
for
implementación
possible
adecuada. En un contexto político en Argentina donde hay intentos de
delays
debilitar las
or
regulaciones sanitarias,
because there
estos
are
resultados
health
reafirman la
regulations
necesidad de
that
defender
could
y ampliar las políticas públicas que
improve
promuevan la salud de la población.
public policies to
Y por último,
ensure
queremos
the
agradecer el
population
apoyo
health.
de la Organización Panamericana de la
Thank you very
Salud
much for
y
your
el apoyo de
support,
los equipos que
PAHO,
hacen posibles
and
estos
the
monitoreos tan
teams that helped us a
importantes.
lot in all
Muchas
this
gracias.
monitoring. Thank you.
Muchas gracias, Victoria. Vemos que es muy
Thank you,
importante
Victoria.
este
We
monitoreo y
notice
en
that
general
this type
contar
of
con
monitoring
datos
is
para definir las
relevant.
políticas
It's
de reducción
important
de
to have
sodio.
policies
En
to
general,
reduce
el
sodium.
consumo de sodio lo medimos
Overall,
a través de la
sodium consumption
expresión
is
urinaria de
measured
sodio
to
y tenemos las
the
encuestas de
urinary
consumo para
excretion of
definir
sodium. And we
las
actually
fuentes
have
de
these
sodio
definitions
en
to
la
define what
dieta
are the
y saber
sources of
también
sodium in our
si es
diet.
sobre todo discrecional o por las comidas fuera de la
We
casa o por los
also could
alimentos
know if this is by food
procesados
that
y
we ate in
también
our
tenemos
homes or by processed food.
estos datos de
We also have
monitoreo.
data for
Argentina ya ha
monitoring
hecho
coming from
varios estudios
Argentina
para poder
because
monitorear en el
Argentina has
tiempo
held several studies
cómo
to
van
monitor
variando
in
los
time
niveles de sodio en los
how
alimentos y qué tan
sodium
efectivos
content is
son
actually
las
changing
políticas
in food
de
and actually how
reformulación. Entonces
effective
son datos
would be
muy
the
importantes y nos han
reformulation
ayudado también para
policies.
establecer las
This
metas
data actually is
regionales
relevant to
actualizadas de
define
la
the regional
OPS.
goals
Entonces,
and updated
muchísimas
goals of
gracias y
PAHO.
recordar a los participantes
Thank you very
que
much.
pueden
Just I
poner
would like
sus
to remind
preguntas
all of
en
the attendees
la
that they
sección
can
de
write down
Q&A,
their
questions and
questions
answers,
in the
preguntas
Q&A
y
section.
respuestas, y los panelistas van a tratar de
And
responder las preguntas en el
the
chat o si no
speakers are going to
en
try
vivo.
to respond
Con esto
to their
pasamos
questions. Having said
a
that,
un panel.
we are going to
Vamos a escuchar
continue
más
with our
sobre las
panel.
barreras,
We're going to be able
desafíos
to
y
hear
mejores
the
prácticas
challenges,
para la implementación de
barriers,
políticas
best
obligatorias para la
practices to
reducción
implement the
del
mandatory
sodio en las Américas.
policies
Entonces,
to reduce sodium
invito a
in the Americas
Malena
region. I would
Guiaya, del
like to
Ministerio de
invite
Salud de
Malena Guiaya from
Argentina,
the
para
Ministry of
que
Health from Argentina so
abran sus cámaras, a
she
Luisa Cipreos del Ministerio de
can
Salud
turn
de
on their
Chile
camera. Luisa
y a Pamela
Cipreos from the
Pelefo del
Ministry of Health
Ministerio
from
de
Chile
Salud y Protección Social
also
de
turn on your camera,
Colombia.
and
Y
Patricia Pibreo
vamos a
from
tener
the
una discusión guiada
Department
y
of
unas
Social Protection from Colombia. We're going to
preguntas.
have
Les
a
puedo
guide
pedir a
debate.
los
We're going to
panelistas
have some questions, and I'm going to ask
que tomen no
the
más de 3
attendees
minutos
to
por cada pregunta.
ask questions of no more than 3 minutes. And I would like to start with one question for Argentina. The same question is something that I'm going to ask the other two countries, Chile and Colombia. The first question would be, can you briefly describe which are the mandatory policies that have been approved and implemented in order to reduce sodium consumption, and which were the main challenges for implementing those? Yes. Good morning. My name is Malena Hiay. I would like to thank you for inviting me to this important event. Just to answer to your question, to complement the presentation from Victoria, after 4 years of voluntary production and working with the industry voluntarily, we had Act 26905 on reduction of sodium consumption, and this act is related to working with the maximum boundaries or limits of sodium. This is of national application through the national code standard from Argentina, and the other side comes from promoting on reduction of sodium consumption. This is related to provinces. This includes having several actions on the gastronomy sector, reducing the salt shakers on the tables, reducing salt consumption in restaurants, among others. Also providing labeling on the salt packaging in order to reduce sodium consumption, and also what's the maximum weight of this products. Also, the law includes monitoring system on the maximum sodium limits. And on the other hand, we include an evaluation of a monitoring plan nationally. What Victoria was stating was that from year 2021, we had the Act 26742, which is the promotion of healthy eating for labeling. We are promoting, of course, reduction of sodium in food. And of course, this food cannot enter schools. And we have certain limits regarding marketing for teenagers and the population overall. Thank you. Now, the same question would be for Luisa Quipreos from the Ministry of Health of Chile. Yes, this is the same question. Just briefly describe the mandatory policies that you have implemented in your country and what would be the main challenges for its implementation. Go ahead with your answer.
Hola, muy buenos días a todos.
Yes, good morning.
Bueno, les puedo contar que
I wanted to
el
mention
Ministerio de Salud
that
empezó
the Ministry of Health
a
of
caballo
Chile
en los tiempos después de la
started
estrategia de la OMS
com-
2006. Ya en el
compiling
2008
information
hicimos
starting from the
un
strategy from the
de reducir el
WHO in
sodio,
2006. So
forma
we started
voluntaria
reducing
con
sodium voluntarily with
el pan.
within bread.
Voluntario,
But
eso
since
no
this is
progresó.
voluntary,
Y luego
not
trabajamos,
mandatory,
se desarrolló en
this
Chile
didn't
con
progress
la
that much.
ayuda de
The other
políticos,
initiative
del
included
sector
the
académico,
assistance
y
of
por
the
supuesto del
academia,
sector ministerial
the political
en
sector, and the
una ley
ministries,
que se llama
because we
la Ley
established
de
an
Prescripción
act, which
Nutricional de
is
Alimentos
the
y
act
Publicidad,
of
que tiene el número
nutritional
20.606, implementada
formulation,
en el 2015,
which was
y se
implemented in
implementó a través de
2015, and
que es
this
el Reglamento
started
Sanitario de los Alimentos. En este
its validity
reglamento y en forma obligatoria se establecen límites
mandatorily, and
transversales
we
para todos los
establish
alimentos. Es decir, nosotros no
cross-sectional
separamos por
limits for
grupos o
all the foods. That
categorías
means that we're not
alimentarias.
separating the foods by
Todos los
categories.
alimentos que
This
superen
means
el
that
límite tienen que
every
poner en
food
su cara
that
frontal
surpasses the
un
limit,
octógono que
they will
diga
need to have
alto en sodio.
labeling that says high
Y
in
de esa
sodium.
manera,
In that
el
sense,
consumidor tiene una
the
información
consumer
fácil de comprender
has information that will be easier to comprehend, to understand, and also to visualize in all of the food that they're going to eat. This act was implemented along with marketing or publishing act that in a way restricts advertising through different media, magazines, television, audiovisual media, everything that would warn the consumer that this is food that is high in this critical element, which is sodium. And also in Chile, we have the prohibition of the food with labeling that has high sodium, saturated fat, high calories, and high sugar content should not be sold or commercialized in schools. What we're working in is to see if we can include also the surroundings of the schools, because this is important. Also, this type of food should not be commercialized in sports venues. We're talking about stadiums, areas where we have large groups of people, like, for example, soccer games. And something that is fundamental would be the restriction of things that would withdraw attention to eating this type of food. For example, TV ads or commercial spots. That means we cannot have cartoons or animals or friendly animal labeling of these cartoons in cereals, in diverse products that could be attractive for children. And the result of these two acts, since this is mandatory, will have to be applicable whether you like it or not. And this has been quite positive because people have decreased the procurement of food with this type of labeling. Also, population can decide to eat food with no labeling. And this is something that we have seen as a result of studies. I have sent the link to Luis of the report that shows the result of the application of this law. This is actually published in the website of the Ministry of Health, and we're going to introduce it in our website as well. We know for a fact that the consumers have reduced and they are choosing food with no label. And just one more thing, sorry, because I need to respond to barriers. Yes, okay, so now let's go back. No, but I'm hearing her. I'm hearing Luisa right now. I don't know if you're having a problem with her
¿Ahí me escuchan?
audio.
Can
you hear me then?
Ya.
Yes. Just start wrapping up. Yes. Okay, so regarding the barriers, the barriers is something that we're going to discuss later. Okay.
Entonces, por el momento estaría,
Okay, so for now, that would be my answer. Yes, thank you. Sorry.
Gracias.
Thank you. Okay, so let's continue with Colombia. We continue with Pamela Viejo. She's going to talk about the Pamela Vallejo. She's going to talk about the policies and challenges. From 2011, Colombia was included in the Americas Declaration on Salt Reduction, and from that moment onwards, we started implementing a series of strategies to reduce sodium consumption within our national strategy. And this includes several strategies. And many of that includes the industrial side. We have the resolution 23 from 2020, and this includes 59 goals for processed products and ultra processed food. Gradually, this will be for 2022 and the other one for 2024. Basically, this is mandatory for all manufacturers. They need to reduce their sodium content within the products. This includes the snacks, sauces, cheese, dehydrated food, bakery, cereal on breakfast, among others. This resolution is relevant because we should be able to decrease content of dietary source for Colombia, which is processed and ultra processed food. We also have the dietary labeling for warning. This is by Act 1810. This was complemented with Resolution 2492. Over there, we include 5 type of labeling. This includes sodium. And we include improvement in the nutritional chart. It should have a minimum side of 25% of the cover of the product. And the specific nutrients, this includes sodium, saturated fat, trans fat. All of these should be with high caps, and it should be easy to read and visible. On the other hand, we have Law 2277 from year 2022. This includes the taxation reforms. This includes more taxes for sugary beverages and ultra-processed food. And this tax, of course, I think it's something quite as a novelty because not many countries have that. And in 2023, this includes 10% of taxation, 2024, 15%, and in 2025, 20%. So we could say that we're in the process of implementing these taxes. What we're looking for is reducing the consumption of this ultra-processed food. Within our strategy, we also have a series of strategies like, for example, healthy restaurants. They, of course, include food with less salt. I would not like to extend more due to time. Thank you.
Gracias. Por el tema del tiempo, vamos a combinar la segunda pregunta.
Due to time, we are going to include the question of barriers, and we would like to include Argentinia's opinion, because after 10 years from the implementing this law, they established the goals of sodium content for diverse categories of processed food. We would like to know what were the results and what were the improvements and the best practices for implementing these policies. You only have 3 minutes. Yes. Well, just to discuss further the implementation of this sanction in 2013, this came from the previous processes with the industry, and that previous phase had a low compliance, but definitely this helped us to have an approval on the law, on the act. Throughout this sanctioning, we had a political support because basically we were having a sanction in two, split it in 2 ways, you would say. And this was something that was in favor, and something that made hard its implementation was incorporating the new limits of sodium through the reformulation of these recipes. And this is something that was a voluntary process, but it was slow. I think that we could improve there. On the other hand, something that could make the implementation more difficult would be that the maximum limits are within the the nutrition code, there are 24 jurisdictions, and only half of them have legislations or acts that abide the national act. So that's why we are working on implementing from the provinces, because each one of them need to comply with all of that. And with regards to what happens after 10 years, well, from the healthy food department, we performed a study. This was held by Dr. Gabriela Flores. We evaluated the compliance of the maximum limits as per the established act according to the nutritional groups. And as Victoria was mentioning, most of the groups, or 3 of 4 groups, have complied with it. So that means that we have a compliance of more than 90%. And I will have to say that this is positive. The study compare the limits between the PAHO and WHO, and we could say that if we comply according to their standards, compliance is even lower, right? We could say that in this case, the objective is to standardize this according to higher limits and including new groups of food in order to comply with that. So I will have to say that these are the upcoming challenges in Argentina. In addition to the province implementation, we have started in 2025. We have restarted with this implementation in order to promote health promotion as well.
Perdón, muchas gracias. Seguimos entonces con Chile nuevamente.
Okay, we will continue with Chile.
Por favor, que nos comenta un poco sobre
and Chile is going to discuss the barriers that were pending in order to include the approval of policies, and they could discuss what were the main results of the standard application with regards to sodium consumption. You only have 2 minutes. Yes, I'm gonna have to be as brief as possible. The main barriers that we had in the beginning, this actually was quite a novelty for us. We were discussing the food habits from the population. And this change of habits is not quick. This is slow. We needed to do several awareness campaigns. We needed to have several citizens forums in which we created awareness for the food consumers. And the barrier that we had from the industrial sector were the costs of changing the labeling on their food, on their products. And we know that eventually this was going to have an influence on their profits. But we did this gradually. In the beginning, we gave them the chance to do it with stickers, maybe not changing all of the artwork of the food products instantaneously. So the approval of the color of this labeling was a problem, we could say, because within the focus group that we held, we noticed that black and white were the colors that had a high impact visually for the populations. So this was something that was quite highly debated by the productive sector. Also, they understood that they needed to do a big reformulation on the recipes of the products, and we know that these products eventually were going to be not accepted for the population because they were debating that they could have less flavor. So in the beginning, we started with longer limits, but after 3 years, we established the definite barriers. So right now, we have a high compliance by the productive sector, and also this food is not being commercialized in schools or sports venues. But this is everything that I have to say regarding the barriers. Thank you.
Gracias. Entonces, inmediatamente continuamos con Colombia, también que nos comente
And
si han tenido barreras para la
now let's
aprobación
continue
de
with
las
Colombia. We would
políticas
like to know if they have had
y
any barriers
también
for the
cuáles han
approval of
sido las
policies
acciones que se
and what
están
were
tomando para
the
la implementación
actions
de las
that
nuevas
they are
normativas
taking
y
now to
resultados
implement
esperados de su
the new
aplicación,
standards and what are the expected
especialmente
results
en
from
relación a las
these
metas de sodio e impuestos a productos
operations. For
ultraprocesados.
example, the
Adelante,
goals of
Fabio.
sodium and also taxation on ultra-processed food. Yes, mandatory standards or actions had lots of barriers because, of course, there was lots of resistance from the industry to approve all of this actions. There was a little bit of a conflict, and I'm sure that Fabio could agree on that with me. But we know that the industrial sector is a bit of reluctant to accept these actions because they think that they are not going to be able to sell their products as much. Advertising could also generate a backfiring effect. And in Colombia, we, we have seen that it has taken up to 8 years to approve this labeling. 3 years to follow initiatives in the Congress of healthy taxations, and this came from the civil society. Several of them were highly debated. The approval was not easy, and I think this was a big barrier. But in the end, we achieved our goal, and the what the industry said as a response to their reluctance was that there was a lack of evidence. They were stating that there's not enough evidence coming from the PAHO or cardiovascular disease. There were questions like, how do you determine that this source comes from ultra processed foods, for example? What's the evidence behind this nutrient model of PAHO? So, including the experience from Chile, we understood that the cost from reformulation, what they started to say was that looking at the experience from Chile, they know that it was highly costly to reformulate these products. And when it comes to implementing or implementation, we have made progress on the guidelines for the industrial sector, manuals for population, campaigns on the use of labeling, campaigns to reduce the salt consumption. We have joined together with INVIMA in order to provide inspection, surveillance, and control, because this also generates a difficulty for Colombia. We need to monitor all different type of products. And that's why with PAHO, we would like to thank PAHO because we are starting a project to evaluate the sodium resolution. And this is an integral study that would include the goals of sodium reduction, the results of how much sodium actually we are having as intake in Colombia. So we're going to have eventually the results of this study on how we have contributed to reduce sodium consumption. And when it comes to the taxation effects, this is something that we are having some trouble with because we acknowledge that from the civil society, there's lots of taxing evasion. That's why we are getting together with the with the IRS, with the civil society, with the Chamber of Commerce, because we need to monitor the compliance of this healthy taxation, not only focusing on including these producers and notifying them of all the taxes that they need to pay, but we also need to provide greater surveillance to see if they are compliant or not. So with that said, that will be all. Thank you.
Muchas gracias, Pamela.
Thank you, Pamela. And I think that something that we can highlight is that they have a complete package of policies. That's why we're interested in monitoring this experience and seeing what are the lessons learned from the experience, and not only from the Colombian side, but also from the Argentinian side. And with that, I would like to thank Malena Diay from the Ministry of Health, Luisa Preos from the Ministry of Chile, and Pamela Vallejo from the Ministry of Health and Social Protection of Colombia for their interventions. And with that, we will continue with our next topic.
I would like to introduce now to Mahmouda Pasha, and she is the director of our collaborating Center on Social Marketing for Public Health, and she is associate professor at the University of South Florida, and working on a manual, and we also have a course on social marketing for public health. We can put everything in the chat, the links, and there are several ways that social marketing can contribute to sodium reduction, and Mahmouda will tell us more about this. So welcome, and thank you very much, Mahmouda.
Yes, thank you, Leo, and thank you, everyone, for this afternoon. Lots of useful information that has been shared, and then I think you will see how some of the information that's been shared so far fits in with what I'm going to be presenting on today. So the focus of my presentation is to introduce you briefly to our history of working with PAHO and WHO on the topic of social marketing, and to also share with you the development, implementation of a curriculum on social marketing and the subsequent documentation of this implementation in this new manual that we are developing for use by public health practitioners. The work that I will share with you speaks from the perspective of the individual citizen within the region, and using a framework to help understand them and to help them in following through on behaviors as well as policies related to sodium reduction. So let me start by giving you a brief background on the University of South Florida and our relationship at PAHO. So next slide. So social marketing at the University of South Florida has a long history. USF has been at the forefront of social marketing research applied to public health for decades. To date, we have collaborated with the WHO and PAHO on several projects investigating the use of social marketing to address non-communicable diseases, specifically related to sodium reduction, and most importantly, in building capacity and providing technical assistance on the use of social marketing. Next slide. The mission of our collaborating center is to address the growing problem with non-communicable diseases by capitalizing on the strengths of social marketing coupled with social change strategies. Our activities are focused around three pillars: that of training, technical assistance, capacity building, and knowledge exchange. Next slide. So in collaboration with PAHO and WHO, we have developed various capacity building trainings and implemented them in virtually as well as in person. These trainings have not only shared didactic information, but have shared practical and applied information that can be tailored and adapted. Part of this capacity building work has been the development of the social marketing for public health courses on the PAHO virtual campus. The presentation that I will share with you today shares the lessons learned from the implementation of these courses with various countries in the region and the outcome associated with the few of them. Next slide. But first, I wanted to share with you a definition of what I'm speaking about when I say social marketing, as often there is some confusion about what this specifically means. So social marketing is a program planning framework that seeks to develop and integrate marketing concepts with other approaches to influence behavior that benefits individuals and communities for greater social good. Our goal is to use marketing tools to promote sustainable and positive social change. We accomplish this by being human-centered or user-centric or focusing on the consumer and understanding their motivations and barriers and developing a product that is responsive to their needs. We use research to get these insights and use marketing techniques to develop interventions that help to change behavior, increase access to service, or promote the use of a new product. In the end, we strive to achieve social good. Next slide. As part of this, we listen to the individual or the consumer to gain insights into their lives, into what influences them, so that we can understand the best way to encourage the behavior change. This is what makes social marketing so distinct and powerful. Once we have this rich information in front of us, we use it to select a specific behavioral target, identify segments or subgroups from the larger population, and we want to give our greatest attention to in designing an intervention. Furthermore, this research that we do or information that we gather from the listening helps us in understanding what is our competition. So what is the individual currently doing for selecting our behavioral targets and what our marketing strategy will address. So we use all of this information to create an integrated marketing plan consisting of the marketing mix or the 4 Ps of marketing. Next slide. So one thing I want to note is that in doing the research and selecting our behavioral focus and the audience, social marketers often employ a system-based approach in understanding the influence and influencers. So understanding this allows social marketers to better position work in relation to who to influence, whether that is someone downstream, such as an individual, or upstream, such as a decision maker. Next slide. So social marketing does not solely rely on education or awareness. It is moving beyond public awareness to actual behavior change. So looking at the example of sodium reduction, as we heard from the presentations on shake, no country is likely to achieve a significant decrease in population sodium consumption when a program is just restrictive to just consumer education alone. We need programs to work in concert with ongoing policy change to make less sodium use the acceptable and the normative behavior. This is where social marketing comes in. So next slide. So to design initiatives that are beyond education, in collaboration with PAHO and multiple partners, we embarked on 2 initiatives related to the application of social marketing in the region, and the development and implementation of an online curriculum, and now it's the creation of a technical manual on how to apply social marketing to reduce sodium consumption. The online courses are for the public health professionals and advocates with no prior experience in social marketing. And the courses are entitled Social Marketing for Public Health. And so you see the picture of it on the side. Once we developed the courses, we implemented this course between July 2022 and June 2023. Various country teams reviewed the content and completed the learning activities with technical assistance provided by our center. We had 2 cohorts based on language, one in Spanish and one in English. Next slide. Just to give you an overview, the structure of the curriculum that we're sharing that's online is comprised of 5 courses, each with 4 to 8 lessons. These lessons are interactive, practical, and based on experience of social marketers from around the world. So course 1 is just an introduction to what is social marketing and presenting case studies. Course 2 focuses on the initial planning. And then course 3 focuses on how do we go about translating research findings into developing social marketing plan as well as a communication plan. And then courses 4 and 5 focus on implementation and evaluation. Next slide. So we implemented this with 2 cohorts, as I mentioned, in Spanish speaking as well as an English speaking over the period of a year. So some outcomes that I wanted to share with you are that for the implementation that we had around 8 country teams from Latin America and 7 from the Caribbean region. This involved over 80 hours of engagement with 6 months of weekly office hours with USF faculty and staff. We had around 17 individuals from the Caribbean graduate from the course and around 12 from Latin America. And then post-implementation, most of the country teams created social marketing plans for implementation, and 2 countries received funding via the American Heart Association and the Universal Health Coverage Partnership to implement and evaluate their programs. And so once these countries implemented and evaluated the programs, we at the center conducted a process evaluation with the country teams on the implementation of the curriculum and the resulting initiatives. All of this work has now been documented in a forthcoming manual entitled Social Marketing for Public Health, a manual or a guide for applying social marketing to the development of health interventions. Next slide. So the manual is meant to complement the online program on social marketing for public health. It is meant to equip public health practitioners with social marketing knowledge and to showcase valuable regional experiences, providing practical tools and strategies to enhance efficiency and relevance. The goal of the manual is to support public health practitioners in the region to create social marketing initiatives, provide examples through case studies from Aruba, St. Martin, and other participating countries, and serves to support the increased use of social marketing in the region to support sodium reduction efforts. Next slide. The manual guides a practitioner through each step of the social marketing planning phase with practical examples, from developing a problem statement, identifying and selecting a behavioral focus, identifying priority populations, to collecting data, preparing creative briefs, and implementing and evaluating an intervention. Next slide. After we introduce each concept, valuable information from various country partners is shared to illustrate the work in action. So here you're just seeing an example that is related to St. Martin, related to the goal that they established as part of their social marketing work, the behavior, the audience, as well as just some images from the materials that were created and from the implementation of their initiative. Next slide. This is just another more, just from the case example that is used in the manual. I don't think we have time to review the video, but I just wanted to show you that this is one of the products that was created as part of the implementation strategy. Next slide. So after we introduce a concept, share a case example of it. Finally, what we do after each of that is we share lessons learned to help future practitioners put the practice into other tools that they can use. So the lessons learned that we share serve a purpose in helping future users to anticipate issues and challenges that they may encounter by way of using the online curriculum and then translating that into implementation in the field level. And so here's just an example. We did around 24 interviews with some of the participants to gather these lessons learned, which are documented in this manual. Next slide. The appendix for the manual provides templates for the learning activities and materials produced by the country partners. Next slide. And here's just one example of one of the templates that was filled out with our case examples, just to help future practitioners understand what this may look like. Next slide. So overall, the manual's aim is to enhance the knowledge and skills necessary for managing communication and behavior change-based programs and policies, bolstering the capacity of public health practitioners to use social marketing in Latin America and the Caribbean. Additionally, this manual and our work in social marketing can further enhance the ongoing work that has been shared this afternoon. And this could be related to policy advocacy and change by creating initiatives with stakeholders to contribute to the development of public policies that promote health and social well-being, such as campaigns to change policies to reduce sodium in processed foods and mandating front of package labeling. It can be used for stakeholder and system engagement by creating social marketing initiatives that engage institutions, governments, nonprofits, and other influential actors to adopt and integrate health promoting practices into operations, such as collaborating with school systems to improve nutrition standards and partnering with employers to create workplace wellness policies. And finally, it can be used for organizational and institutional change by creating social marketing initiatives that support organizations in developing internal policies or cultures that promote healthier environments, such as encouraging food vendors to reduce salt in cafeteria and meals. We hope this manual that we create serves as a complementary tool to the curriculum that we have created, so that not only Ministry of Health officials, but also public health practitioners in the countries can utilize it to go about implementing, salt reduction strategies, policies, and programs. Next slide. So finally, this is my contact information, and then I'm here for any questions that you may have. Thank you.
Thank you very much, Mahmouda. And I think it shows that social marketing can be used in several ways to promote sodium reduction strategies. It also shows that when we do a good strategy, when we do a good formative research, when we make a good strategy, communication strategies can be effective. The problem is that often we go immediately to the folder and brochure without following the adequate planning process. So all this can be learned in this manual that will come up. And of course, we invite everyone to do the free program as well. I've just put the links in the chat so you can all access free of charge this social marketing program. So thank you very much, Mahmouda, and we're looking forward to seeing the manual that you presented today.
Thank you.
Then we continue with Nadia Flexner. She is from the GUI, the Global Advocacy Incubator for Health, and she will present on recommendations to establish sodium reduction, compulsory sodium reduction targets. And she is working in the Global Health Advocacy at Incubator. Please go ahead, Nadia.
Muchas gracias, Leo. Buenos días y buenas tardes.
Thank you very
Gracias
much,
por la
Leo.
invitación
Thank you very
desde
much for the
GHI,
invite
como también es conocido en la región. A
from
través de nuestro programa de alimentación y
GHAI,
nutrición, trabajamos de la
from
mano con
our
organizaciones de la sociedad
food
civil
program. We work
para
with the civil
impulsar la aprobación e
society
implementación de
to
políticas que son
boost the
basadas en
implementation
evidencia.
of policies based on
Actualmente
evidence.
apoyamos
At
estos
this
esfuerzos
moment,
en
we're
más de
supporting
30
all these
países en
efforts in
África,
more than
Asia y las
30 countries,
Américas,
Africa,
con el objetivo de
Asia,
promover
and
sistemas alimentarios más saludables
Latin
y
American
sostenibles.
countries to
Y bueno, hoy mi presentación
promote
se enfocará
sustainable
en la política de metas
food.
obligatorias
This
de
is
reducción del
today
sodio.
I'm going to
Siguiente, por favor.
focus on sodium reduction. Next.
Como ya fue mencionado, una de las
As
intervenciones más costo
mentioned,
efectivas o
one of
best buys
the
de la OMS es la
best
congelación
buys
de
of
alimentos. Siguiente, por favor.
WHO are on the screen.
Esta es una estrategia
This is a
fundamental para reducir
strategy
el
that
consumo
is
de sodio en la
fundamental
población,
for sodium
y esto
reduction
implica reducir
in
los
the
niveles de
population,
sodio en
and
los
this
productos
implies the
empaquetados y los
reduction
alimentos
of
usados de
sodium
calidad.
in
Siguiente.
packaged products without compromising their
Muchos
taste.
países, como hemos
In many
escuchado,
countries,
han adoptado de
as we
manera
heard, have
voluntaria o
adopted
mandatoria
in a
metas de reducción de
voluntarily
sodio.
manner
Tenemos los
the
ejemplos de
sodium
Canadá, que adoptó
reduction. For
metas en el
example, Canada
2012 con
in
un
2012
inicial de 94 subcategorías. Lamentablemente,
with
después de más de 10
34
años de
subcategories, and
implementación, los
after 10
resultados no
years
son
of
muy alentadores.
implementation,
También
outcomes are
tenemos el
not
caso de Argentina
really
y South
good. We
Africa,
have Argentinian
Colombia,
case,
que
and
han
South
implementado
Africa and
metas
Colombia
mandatorias.
implemented
Ya tenemos
mandatory
algunos
targets.
resultados de Argentina
We have
y
some
de South
outcomes
Africa,
from
donde se ha visto
Argentina and
reducción
South
de
Africa, where we have
poblacional
seen
y
the
es
reduction of the salt
y
consumption
que la
and the
industria está
population,
implementando
and
las
the industry
medidas.
is still
Siguiente, por favor.
implementing the measures.
A nivel global y regional, la
At a
OMS ha
global
publicado
and
metas de reducción de
regional
sodio, como
level,
escuchamos, y por
as
ejemplo,
you
OBS
have
estableció sus
heard,
metas, como bien dijo Leo, en el
PAHO
2022,
has
establecemos
implemented these
75
targets,
subcategorías.
introducing
Siguiente, por favor.
75 subcategories.
Y bueno, Esta semana, desde
This
GHAI,
week,
publicamos un documento de posición sobre
from
las metas limitativas de
GHAI,
reducción de
we
sodio.
have released
Vamos a
some
compartir el link en el chat en un momento.
policies.
Este
We are
documento
going
fue
to share the
desarrollado en
link. This
colaboración con los
document
Future
has
Lives,
been
donde
done
describimos los
with
pasos necesarios para establecer metas
between
limitadoras de reducción de
JHAI
sodio.
and PAHO
Esto, por supuesto, ha
with
sido basado en
to
experiencias de
collect and
países
analyze
donde los
population
proyectos se han
level sodium
implementado
intake
de
data,
manera
and the
exitosa.
policies have
El documento
been
también
implemented
proporciona
in a
recomendaciones
successful
claras
manner.
para
At this
ayudar a
moment,
tomadores
we're
de
trying
decisiones
to
y defensores de la salud pública
provide some
a desarrollar y
recommendations
avanzar
to
en
public health
políticas
institutions
como las
to
metas obligatorias de reducción
progress
de sodio.
in terms of
Por ahora lo tenemos
sodium reduction
disponible solo en inglés,
policies.
pero planeamos
We
una
just have it
nueva
in
versión
English
en
at this
español muy
moment,
pronto.
and we're planning to have
Y
this
bueno,
in
con eso,
Spanish very soon.
brevemente voy a mencionar los pasos para que
Let me
hemos
give you some of the
incluido. Ustedes
steps
pueden
we have
encontrar mucho
included
más
in this
al respecto. ¿Me
document.
escuchan bien? ¿Me escuchan ahora?
Can you
¿Mejor?
hear me now?
Estaba viendo un mensaje. Ok.
Te escuchamos bien.
Ok,
We
perfecto.
can
Me
hear
mandan
you.
un
We can
mensaje que
hear
dice que me
you.
escuchan bajito. En
I
fin,
saw a message saying that you couldn't
espero que me
hear me
escuchen
well.
mejor ahora.
Okay,
Pero
I hope you can hear me well now.
empiezo con los pasos. Primero, por supuesto, debemos conocer
First
bien
of
el
all,
contexto.
we need to
Idealmente
have
necesitamos
the
entender cuánto
context, and
sodio
we
se
need to
consume por la
understand how
población,
much
de qué
sodium the
fuentes
population
provienen
is
y cuál es el contenido del
consuming,
sodio en los
where it comes
productos
from,
que
and
están
what's the
disponibles en el
content
mercado
of the
nacional.
products
Eso
that are
nos
available
permitirá
in the
establecer
national
metas
market.
realistas y
With this,
basadas
we
en
will
evidencia.
have
Siguiente,
realistic
por favor.
targets.
Luego necesitamos definir el alcance de la
Then we
política.
need to
Podemos optar por
define
un
the
modelo
scope of the
integral
policy. We
que
can
abarque la
have
mayoría
this
del suministro
comprehensive
alimentario o
model
empezar con el modelo más
in
conservador que se enfoque en las
covering
categorías de
all of the
alimentos que
different
son más
aspects, or
problemáticas.
only for the
La
products
decisión,
that
por supuesto,
are
dependerá
an
de la
issue,
capacidad del
and the
país y de
decision
sus
is going to
prioridades de
depend
salud
on
pública.
the
Siguiente.
country capacity and the public
Ahora
health
bien, al momento de definir las metas, se
institutions.
recomienda
When
establecer límites
defining
máximos de
targets, it
sodio
is
por
recommended
categoría.
to
Este enfoque de límites
have
máximos es
maximum
principio.
limits,
La evidencia
and
nos
this
ha,
category,
la
according
evidencia y la
to
experiencia de los
the
países nos ha
evidence
demostrado que es
and the different
práctico, fácil de
experience in
implementar y
countries,
permite
is
que la industria
practical,
realice
easy to
ajustes mínimos que
implement.
no tengan impacto
The industry
real
just have to make some
en
adjustments
términos de los niveles de
in
sodio
terms
en los
of
productos
sodium
empaquetados.
levels
Además,
for
es el
packaged
enfoque
products.
que ha sido
This
adoptado por la
approach
OMS y
has been
también por otras
adopted
agencias
by
regionales. Siguiente.
WHO and other regional agencies.
Luego es necesario identificar las categorías claves de alimentos,
It is
no solo
important to
aquellas con alto
identify
contenido de sodio, sino también las que son ampliamente
setting
consumidas por la
sodium
población
reduction
y
targets,
evaluar
not
los
only the
niveles de
ones that
sodio con
are the most
referencia a las metas
consumed by
locales y
the
regionales y cómo
population, but also see
el
these regional
nivel de
targets and
sodio
how the
de los
level of
productos
sodium
nacionales
of
se
national
reflejan en
products
base a eso.
are reflected
A
on
veces
these
es útil
targets.
trabajar con
It's
subcategorías
useful
para
to
tener un
work with
control más preciso sobre
subcategories to
productos
have a more
específicos dentro de una
accurate
misma familia de alimentos. Y es en este
monitoring
paso donde se va a
and the
determinar si es
different
necesario
foods.
tener
And with
categorías,
that, we
subcategorías dentro de una
determine
categoría o trabajar
subcategories
al
within
nivel de la
one
categoría más,
category or
más o
working
mayor.
at a category
Siguiente, por
level.
favor.
Next,
También
please.
es importante considerar
It
el
is
contexto
also
nacional.
important to consider the national
Pueden haber
context.
productos que no están cubiertos por las referencias
There are
globales y
products that are
regionales, pero
not
que
covered
representan
by
una
the
fuente
national
relevante
or
de sodio en el
regional
alimento.
targets,
Y
but
estas
they
decisiones deben
represent
ser revisadas por grupos
sodium,
técnicos sin
and
conflicto de
these should
interés,
be
lo que va a asegurar
analyzed
que
by
las metas
technical
respondan al interés
products,
público.
by
Siguiente,
technical
por favor.
groups, sorry.
Una vez definidas las metas, debemos
Once we
establecer un
define the
cronograma.
targets, we
En este
need to
cronograma debe
establish
ser
or
claro,
set
debe ser un
timelines, and
cronograma
this
claro y
timeline
escalonado,
should be
permitiendo la
clear
formulación de productos de manera
and
progresiva
phased
y
timeline
facilitando un
for
proceso
sodium
de
reduction
implementación
targets,
efectivo y
essential to support
sostenible en el
effective
tiempo.
implementation, enable gradual
Siguiente,
project
por favor.
reformulation, and promote
Un
long-term
aspecto clave
activities.
es la
One key
consulta
aspect
con actores
is
relevantes.
consulting on
Esta
mandatory
etapa debe
sodium
ser
reduction
una etapa
targets with
abierta,
key
por supuesto,
stakeholders.
basada en
It
evidencia y
should be
enfocada en
open
discutir la
based on
viabilidad técnica de
evidence
las metas propuestas.
and
Aquí se sientan las bases para un
according to
compromiso
the
político que
technical
realizan
feasibility of proposed
alineadas
sodium
expectativas
reductions.
con todos los sectores
Open and
involucrados.
transparent dialogue with key stakeholders
Siguiente,
in
por
line
favor.
with WHO
Durante estas
recommendations.
consultas es esencial
With
recordar
these
que la salud pública debe
consultations,
estar
it's
por encima
important
de
to
los intereses
understand that
comerciales.
health should be
La
prioritized
industria
over
puede
commercial
participar
interests. The
presentando
industry may be
comentarios durante
engaged
la
through
etapa de
public
comentarios
consultations
abiertos al
where they
público,
will
pero las
have the
decisiones deben
opportunity
priorizar el
to
bienestar de
submit
la
comments
población
on the
y
proposed
después estar guiadas
regulation
por la evidencia científica.
and guided by scientific evidence.
Y como punto
4. Once targets are validated and defined, they should be incorporated or incorporating sodium reduction targets through regulation or law. Adopt a mandatory approach through regulation or legislation. Establish a strong evidence-based mandatory opaque labeling requirement, and others.
Y bueno, a medida que la política avanza,
as policies are progressing, there could also be the establishment or more strict laws, progressively include lower sodium laws and others. It is important to establish a multidisciplinary national working group to develop the policy, assess its implementation, monitor compliance, and evaluate its impact. The implementation timeline should consider the challenges faced by small and medium-sized industries, allowing them a longer transition period to help them. And as a final step, monitoring enforcement through a robust and transparent process by an appointed government or independent body that is free of conflict of interest, setting specific timelines aligned with the policy targets timeline, and assessing changes in product energy and sodium content, as well as the use of alternative ingredients. Monitoring enforcement. Monitoring reports should be made publicly available to ensure transparency and accountability, using regulatory authority to penalize non-compliance. This is a clear message that the policy is designed to protect population's health. This is the position paper. The QR code is on the screen. If you're interested in reading a little bit more of these steps that I mentioned. Next, please.
Y bueno, solamente para terminar mi presentación, quiero
just to finish,
resaltar algunos puntos claves o
some key points to be highlighted on best practices.
Perdón, no, está bien. Creo que es el anterior, Luis.
The previous one, please.
No, la siguiente, perdón.
The next one,
Gracias.
please. Thank you.
Hacer que las metas sean obligatorias asegura mayor cumplimiento,
make the targets mandatory, as we heard from other participants, and ensure transparency, while the policy is designed with frameworks to protect public health from commercial interests. The use of global or regional guidance aligned with WHO global sodium benchmarks or regional targets to align the efforts with available evidence. Adopt a stepwise approach, so gradually reduce sodium levels over time, adding more food categories as needed with the consumer adjustment. Set maximum limits and use a maximum limit approach to facilitate enforcement and monitoring, and adapt to context. Use a comprehensive model or in high capacity settings and start with a conservative model. Standardized targets, 100 grams and 100 milliliters. Plan for monitoring and enforcement. Establish monitoring led by independent, conflict-free introduction before implementation, and ensure the funding. And of course, complement with other measures such as front of package warning labels and marketing restrictions, among other best practices. Support behavior change. Number 10, use communication campaigns and education to reinforce policy impact to help population understand the policies by using methods, as Mahmoud mentioned, social marketing. That would be really, really good. And with this, thank you very much for your kind attention. And I hope you have an excellent week of awareness. Thank you very much, Nadia, for giving us this guidance and explanations on how implementing and setting targets of sodium reduction. It's really important. All the civil society role on the advocacy of public policies and help in the implementation of the policies. We have listened to many sessions that there are some difficulties in the policies proposal. There is some resistance,
Vamos a escuchar ahora al colega
conflict of
Fabio
interest. And now
da
we're going
Silva
to listen
Gómez.
to
Él es el asesor
Flavio
regional en
Gomez. He
en
is
nutrición y actividad
regional
física de la OPS
consultant
aquí en
on
Washington
physical activity
y
and
nos va a hablar
nutrition
de
in
prevención de los
Washington.
conflictos de
And he's
interés
going to
en
talk
el
about
desarrollo e
interest of
implementación de
conflict
políticas para la reducción
and
del
the
sodio. Adelante,
implementation
Fabio.
of policies on sodium.
Muchas
Go ahead,
gracias,
Fabio.
Leo. Y
Thank you
bueno,
very
sí, yo creo que
much,
ese es un
Leo.
desafío
I think
que
this
a
is a
todos los
challenge
países
for all the
enfrentan.
countries.
Y una de las cosas que
One of the
hemos
things
tratado de especificar en varios de
we have tried to
nuestras
specify in
recomendaciones
many
es
of our
posible la adopción
recommendations,
de metas mandatorias para la
adoption of
reducción
mandatory
de sodio.
regulations for sodium
Además de
reduction,
asumir ese liderazgo,
apart
es
from
muy importante que las autoridades
the
de salud
leadership
puedan
assumption,
hacer
it's really important
para adoptar
to
esas
that the
metas
authorities
y
should
otras políticas efectivas
adopt
para la
all these
reducción
effective
de
policies on the
sodio.
reduction of
Es
sodium.
importante que la
And
implementación y
it's
aplicación
important
de
that
esas
the
políticas, bien como el
implementation
diseño de esas
and
políticas, en el momento
uh,
que se
of these
realizan de
policies,
manera multisectorial,
when they are done
tengan
in a multi-sector
salvaguardias
level,
adecuadas contra los
have
posibles conflictos de
adequate
interés. Y
safeguards
eso es
for possible
fundamental porque si no
conflict of
tenemos
interest.
estas
And this is fundamental
salvaguardias,
because
posible que
if we
las
don't have
políticas
these
puedan ser
safeguards for
debilitadas,
policies, they
retrasadas
could be
o mismo
weakened, delayed,
impedidas de
or
avanzar
blocked
una vez que
once
actores que pueden estar
there are
buscando defender sus
stakeholders
intereses
trying to defend their
van a intentar
interests.
obstaculizar
They
el
will
avance
try
de esas
to
políticas.
block
Y
the
es por
progress
esa
of these
razón que
policies.
hemos
This is why
trabajado
we have
con
been
los países
working with the
en
countries
establecer mecanismos
on
de
setting
prevención
mechanisms
y manejo de conflictos de interés en
preventing and
programas de
managing
nutrición en
conflicts of
general,
interest in country-level
incluido
nutrition programs,
políticas relacionadas a la reducción
policies
de la sal.
regarding
Y
the
es
salt
una
reduction.
hoja de ruta que
This is a
permite,
roadmap
no va directamente a dar
helping
las
us
respuestas, eso es lo que
to
tiene que hacer o no tiene que hacer,
not having
pero
the
indica
answers
un
on what we
camino
need
por
to
lo
do or
cual
what we
los
shouldn't
países
be
tienen que
doing,
revisar
but
sus
it gives
procesos
us a
de
guidance
decisión o
on
sus procesos
the decision
regulatorios
making
y ver
process,
cuáles son
regulation
los elementos
process,
y
and
mecanismos que podrían poner en
set
lugar
the
para
mechanisms
asegurar que
and
esos espacios de
elements to
formulación
ensure that this
y adopción de políticas estén
policy
salvaguardados de esta
adoption
interferencia
spaces
de
are
actores que
safeguarded
están con
from
intereses
actors
opuestos a
or
los de la
stakeholders
salud
who
pública. Dentro de esa
are opposed to
herramienta,
these
este es el
policies.
documento que les enseño,
Within this
hay una herramienta
tool, there is another
electrónica en
tool
donde utilizamos dos
where
versiones,
we
una más
use
larga
two
y una más
versions,
corta que llamamos
a long
herramienta de
version and a
triaje,
short
en
version.
donde ustedes
We
pueden,
call it
otra
triage
vez muestra una
tool.
herramienta que les va a dar la respuesta, pero
And
les
this
va a
tool will
hacer
not give you
las
answers,
preguntas necesarias que
but
son
to ask you the
importantes
important
hacer para
questions
entender cuán
to
alineado o
understand
desalineado van los otros
how
actores
aligned
que
or
pueden hacer parte de este
these
proceso,
stakeholders
sean en
are in
consultas
this
y en otras
process.
instancias. Y esto va a ayudar a que
And
los
with
procesos de
this, we
decisión
will
puedan estar
have
bien
this
armados y protegidos
decision-making
de estas
process to be
interferencias
protected from
y puedan
interference
debilitar, impedir o retrasar
that may
el avance
weaken
de
or
políticas, incluida
delay the
las
policies.
políticas efectivas de reducción de sodio, como el tema de
Sodium
las metas
reduction
o
policies
etiquetado
in terms of targets,
frontal, etc.
front
Y tanto cuanto
front
pensamos en
packaging
las
policies and
políticas
others.
para reducción de sodio y para
When we
otras,
think about
otros
sodium reduction
resultados
policies or
de
other
alimentación, es algo que
results,
queremos alcanzar. También es importante
it's
pensar la
important to
prevención de
think
conflictos de
about
interés desde el punto de vista
conflict
no
of
solo de
interest,
ir
not
directo a
only
pensar las
from
soluciones,
the
pero
perspective
pasar
of
por
solutions,
revisar cuáles
but
son los
to
problemas
review what
relacionados
the
a conflictos
issues
de
are.
interés,
These
identificar
issues
este
related
problema,
to conflict of interest,
identificar los
identify the
causantes
issues
de este problema, o
and
sea, de esta interferencia.
identify the cause of the
Entonces,
interference.
está muy bien documentada, no solo en el ámbito de la alimentación, pero también
This
en
is properly documented
otros
not only
productos
for
malsanos como
food,
tabaco, alcohol,
but also we have other products that are healthier
industrias en particular, bueno,
for
también de productos
industries related to processed food and
muchas
ultra
veces
processed foods,
actúan de manera
many times
similar a las
we
industrias
act
tabacaleras y de alcohol
similarly
para
that
interferir
the tobacco
en la
and
opinión pública
alcohol
o interferir en
industries
los procesos de
in
política
order
de
to
distintas maneras,
discuss the
no solo en
political
sus prácticas
processes.
comerciales que
And the
buscan
idea
expandir productos
is
malsanos,
that we
pero
discuss
también
not only the
prácticas,
political
digamos,
practices, but
corporativas para
or
interferir
trading
e intentar dar
practices,
formas a las
but
políticas de
also
manera que
start
puedan
discussing their
favorecer a los
corporate
intereses de esas empresas. Y eso es
aspects that would
material de
favor
evidencia
these
que es muy
companies. So
importante tener
this is
documentado
something that
porque
we
eso
need
nos
to
ayuda a
document
justificar
because this
por qué
will
no.
help
Porque
us
muchas
to
veces
justify
tenemos,
or
bueno,
not.
a algunos parece obvio que determinada
It would
empresa
seem
regulada no
obvious
debería
that
tener
certain
parte en la
companies should
decisión
not be
sobre una
part
política de salud pública, pero es siempre
on
importante
decisions
justificar por qué
for
no, ¿no? Y por qué están
public
en contra y
policies,
exponer cómo
but
están
we would need to
actuando en
justify
contra de las políticas de salud
why
pública.
are they against
Y eso
these
dentro de
public
las
health
distintas
policies.
tácticas, hay muchas
And
tácticas de
within the
productos
different tactics,
malsanos
we have,
producidos,
for
no solo
example,
de productos
um,
como productos de tabaco, alcohol,
tactics
productos
for unhealthy
procesados
products.
excesivos en sodio y otros
We're
nutrientes que
not only
tenemos
talking about
que
tobacco
limitar. Y
and
estas tácticas van
alcohol.
a variar a depender del
These
escogido de
tactics
política
would
también. Si
depend
estamos, por
on
ejemplo, en el proceso de
the
diseño de las
policies.
políticas, es
If we are
probable que las
designing
industrias
the
lleguen con una
policies, it is highly
propuesta
likely
o
that the
una
industries
táctica que se
have
llama, por ejemplo,
a
sustitución de
tactic
políticas. El
which
momento que la
is
industria
policy
dijere, no,
substitution.
quizá mejor que esta política que se propone,
The industry could say,
que sabemos que es efectiva para la salud pública,
we
propongan
know that
una
this policy
alternativa
is good,
inefectiva o
but
poco efectiva, como por ejemplo un
we
abordaje
let's go
voluntario
for
o por ejemplo una otra
another
política que
strategy
no
like
es efectiva
voluntarily
como la que se está proponiendo. Y en la
strategies.
medida que eso va
And
avanzando y ellos no
as soon as this starts
tienen éxito
moving forward,
en debilitar o impedir una
they
política, van
would
a
be more
intentar
successful in
retrasar,
weakening
introducir
these
dudas, ¿será que
policies.
realmente es
They would
necesario reducir el
delay, they would
sodio,
introduce
la
doubts,
ingesta
they
de
would start
estos
asking,
productos?
is this
¿Será que
really
realmente la
important to
ciencia está
reduce
correcta en lo
sodium?
que dice?
The
Y
science
lanzar
is
estudios que puedan generar esas dudas
accurate in what
para
they're
intentar
saying.
generar,
They are
levantar
going to
y establecer
try
esta duda. No tienen la
to
intención de ellos estar con la
have more
razón, pero
doubts
simplemente
into the
introducir la
minds
duda
of
para que
others.
podamos
They would like to
retrasar y
introduce
no haber
this
una claridad de
hindering
que tenemos que seguir con la
aspects
política.
in
Finalmente,
order
si
not to
superamos
continue with the
esta
policies.
etapa y
In the
empezamos
end,
ya a tener
we
muy
would
claro que
surpass
la
this
política
phase.
avanza, van a intentar quitar
And
esta
once
política.
they
Ya viene
know
que
that
ya entienden que la política va
this
a
is a
seguir,
policy that is
entonces
going to
lo que
continue,
quieren ahora es
what they're
buscar
going to do
debilitar los
is
parámetros,
that
por
they're
ejemplo,
going to
cambiar los
weaken
límites de
the
reducción
parameters. They would try
de
to
sodio
change
para que
the
estos
limits of
límites
sodium
máximos sean un poco
reduction
más,
for these
más altos
limits
y permitan
to be even higher,
sean más
and
débiles en
in
relación a la
order to
necesidad de
have
reducir los
weaker
productos
limits,
y
in order not
o
to
mismo
have more
cambiar o
changes in their
eliminar
products,
determinadas categorías
they could
antes de reducir
also
la presencia de
reduce certain
contenido de sodio y
categories
como
or the
consumo de sodio
content
sobre
of
estos
sodium
productos, por ejemplo.
on those products.
Una vez avanzando esto, bueno,
Once we
superamos eso y
continue with the
seguimos con parámetros
phases,
firmes y
if we
bueno,
continue
recomendados por la
with
OPS,
firm
por la
parameters
OMS, o
and the
sea, en línea con las
recommendations of
recomendaciones internacionales de salud
WHO,
pública, van a intentar
along with the
retrasar que
public
esta medida se adopte o
health
se implemente, o sea,
recommendations, they're
pensar y
going to try to
proponer
delay
fechas de inicio
the
de implementación que
implementations.
son
They're
mucho
going to
más largas de lo que necesitamos para
propose
retrasar
extended times
este beneficio
in
a la
order to
población
delay
y retrasar el
these
tiempo
changes,
o ganar más tiempo
in
para que
order
ellos
to
puedan
gain more
seguir
time,
sin hacer las modificaciones
in
que
order
se
not
exigen. Y
to
finalmente,
do the changes that they should do.
si
And finally,
fallan
if
en este intento
they
de retrasar la
fail
política,
in
muchas
delaying
veces
these
incluso lo
policies,
intentan impedir la
they are
política
going
después
to
la política
try
ya
to
está
stop
implementada
these
en campo, o
policies.
sea,
Even
en la
if this
mesa,
is implemented
los productos, ya tenemos la
with
reducción
these
implementada y
products
verificada por
and
las
everything is
autoridades sanitarias y
implemented and
intentan muchas
verified
veces
by the
impedir eso
authorities,
con
they would try to
litigios
still stop this through
usando el poder
litigation. They're going to try to
intentos de litigar
use
esas
legal
políticas para impedir
aspects
que
in
puedan seguir
order
aplicando,
to
¿no?
avoid its
Es muy importante
implementation.
conocer esas políticas porque
It's
eso nos
important
indica
to know
que
the
si
policies
esas
because
empresas lo
these
están
states,
haciendo en
that
un país o en
countries
varios otros países y
could
eso
be
tenemos
doing
evidencia,
this, not
eso
only,
también nos indica que no solo
or
sus
companies could be
productos
doing
son
this in different countries.
una referencia de
This
lo que
would give us
tenemos
an
que
idea
mirar
that the products should be properly monitored in order to define the key players in these instances. We also have the best practices. And within the best practices, to prevent these interferences, we have the involvement of the surveilled sector, and we're going to have some time to do the public consultation. And this would be related to weakening or delaying these changes. The actors should not be involved in these policies in order to avoid these interferences. And in the end, we need to empower the civil society organizations in order to monitor and expose the tactics of these actors. So it is important the implementation this in countries and continuing to implement this in the legislation. Some examples on how countries have moved forward in adopting these policies. Well, this is not only related to sodium reduction, but to the right, we could see a technical report that was issued from the Ministry of Education in Brazil stating that there's a guide on what key actors are not going to participate in the program.
Las comisiones de alimentación escolar locales o estatales, etcétera, para evitar que
and this would avoid the interference of these actors according to the products and the commercial practices or corporate practices that these companies have. And a proposal that would establish mechanisms of conflicts of interest and people that have businesses or objectives that should be regulated by these policies of healthy eating.
No pueden estar en el proceso de decisión de política, así que un avance y un ejemplo muy importante para la región, en el mundo, en cómo avanzamos, en que las políticas no solo tengan mecanismos e instrumentos efectivos para alcanzar los objetivos de alimentación saludable y políticas.
And this would help us to reach our objectives in order to have effective mechanisms to protect our spaces in order to avoid interference from other actors that are not related to our objectives. So with that, I would like to finish my involvement or my talk, and thank you.
Fabio,
thank you, Fabio. I think it's interesting to think not only about salt, but also the regulatory framework. And also thinking about what provides sodium for the food. So it is quite relevant to handle suitably the conflicts of interest. I would like to mention as closure the policies that we have seen, and we're gonna have a new shake. This is introduced by Kaya. We know that these objectives are feasible and are highly cost effective. We have seen when we launched the goals, the updated goals of the PAHO, we have noticed that 25% of countries are already complying with these goals. So that means that this is possible to implement. And this is something that we're seeing in the values of reference of the WMS, of the WHO, sorry. And we know that this includes lower content of sodium in products than in the regional goals from the PAHO. And we know that it's visible to reduce sodium content in foods. We have seen that it is highly important to implement an integral package on activities, and we have also heard experiences from Argentina, Chile, Colombia, how we have seen how they were able to continue with the lower objectives, and little by little several countries are going to be able to move forward on this sense. We have heard about the importance of social marketing as complementary or supplementary strategy to public policies coming from the civil society, and the role on managing conflicts of interest. We have more than 500 attendees, so thank you everybody to be connected. And in the chat box, I have included the website of the event for Spanish and English, and this is where we actually have the recording of the event, and we also share today's presentation. And if there are further questions, please feel free to contact us or contact the speakers. So with that, I would like to wish everybody a happy awareness week, happy salt awareness week, and I hope to continue contributing with you on encouraging policies in favor of public health and the world. Thank you.